A running locking stitch actually seems very complicated when you first see it done. It's actually very simple when you just go ahead and do it yourself, either in the operating room or just on a practice pad. Just like a simple interrupted, tie it down, 1, 2, 3, 4, 5, 6, 7. Let me just go here. This is a nice stitch because it provides hemostasis. I really don't see it used outside of obstetrics that much, but you know, it is nice if you're suturing up like an episiotomy or suturing on the uterus. So here, the difference between locked and unlocked is that this is unlocked and this is locked. That's all it is. You just pull it out through the loop, pull it tight. Some textbooks will say that the reason it's called locking is that you actually don't need an assistant, because when you pull, it locks on its own. But oftentimes in the OR, you're going to have your assistant, you hear people say that your assistant provides the tension by holding the tail of the suture. But either way, you can see here it's going to lock down nice. And the first couple throws will come a little bit loose, but after I put a couple more in, you'll see that even without holding the constant tension, it will keep tight. We'll just do this one, then we'll tie it off. Now you may be thinking it's a little bit complicated to figure out how you're going to tie it off, but essentially you just don't lock the very last one, and then you just tie it to the loop. So we just come here, and instead of locking, we just pull the needle out here, and then we can actually just instrument tie or hand tie to our free loop right here. And you may want to put the instrument through the loop to help tie it down. You can even do a surgeon's knot if you want it. If you don't do a surgeon's knot, just make sure to apply good tension when you put that second throw down to complete your first knot, and that'll help bring everything together nicely. 3, 4, 5, and 6. And if you want, you can put this through there and pull with your instrument through the free loop as well. One of the important things after doing this is if you do, you know, if you are doing like a skin closure, you're going to want to be careful how you take this out, because you don't want to leave anything left in the patient. On your closing end, the end that you ended up with, you're going to want to cut the stitch twice only. So once is once right there, and then you can see the whole loop is right there, and I just cut it once, then cut your knot off right there. Everything else will pretty much just come up easily. So far I've just cut this stitch in 2 locations. Now of course, if you're doing this you know, like on the uterus and it's an absorbable suture, then you'll never take it out, it will just absorb. But if you are suturing on the skin, you know, you want to remember this when you take it out. So I cut twice down here, and then at the top I just cut once, and then it pulls out like that.